I have a 2.5-year-old that I currently have to literally lay on the floor and put my legs over his shoulders to get his teeth brushed.
I realized that I've always hated going to the dentist, which I think is fairly common.
We should start brushing from day one. That's going to look different if we have teeth or don't have teeth. When we don't have teeth, we can use a washcloth, we can use a little gauze. Every time we eat, the pH in our mouth becomes acidic. So if we're constantly at this acidic environment, we're going to get cavities.
I used to take my daughter when she was younger to the dentist. She has been a thumbsucker forever. She is just turned 10. She sleeps with her thumb in her mouth. Then I took her to the orthodontist who said she's got to stop soon because if not, it really is affecting now the placement of her teeth. Hi, everybody. Welcome to another episode. Today is going to be a little bit different. Sometimes we talk about social, emotional health of kids, of parents. Today we're going to get a little bit into that, but really into the nitty gritty practical stuff that when a lot of parents do sessions with me, they sort of talk about their biggest power struggle times of the day. And there is never a time where they don't mention brushing your teeth. So we're definitely have the right guest on here today. We have Yamila Garber. She is a pediatric dentist. And I then found out that my daughter actually goes to her. It's the same practice. Yes. And even more aligned, I just got back from the dentist. I had my dentist appointment today, and it was interesting, Shami, because as I was sitting in that chair, I realized that I have always hated going to the dentist, which I think is fairly common. But one of the things when we were talking about things we would talk about today that we went over were parental kind of perspectives. And I was like, I wonder how my feelings about the dentist, first of all, how they were wired into me, but secondly, how much or little they're getting sort of transmitted onto my daughter and now my little daughter that will soon be going to you too. So why don't we kind of start off with talking about that? And thank you so much for being here, by the way.
100%. I think it's a great topic to dive into because I think it's very important. First of all, thank you for having me. I'm very excited to be on and give some tips. But yes, that dental fear and that dental anxiety that we have as adults when we go to the dentist, I, as a dentist myself, have it as well from that childhood trauma grows with us. And a lot of it also stems from our parents' feelings towards the dentist.
When did it get such a bad rep? What happened?
You know what? If I had a quarter for every time someone's like, I hate going to the dentist, oh my gosh, I'd retire. But no, so one of the things actually that brings me a lot of joy is when I have patients come in that maybe had previous traumatic experiences and being able to kind of meet them where they're at, where their needs are at, and kind of change their view of the dentist and have parents text me later and be like, you know what, for Halloween, they want to be dentists. For career day, in school, what do you want to be when you grow up? Dentist. Thank you so much for changing my
Their
child.
mindset.
And a lot of it comes, and I tell parents, I see this so much. Our children thrive off of our energy and they sense our anxiety. So a lot of times just trying to breathe and stay calm is going to help so much with just how the dental visit will go. And many times I see this, especially when we're going to do treatment, when we may have to restore a cavity, fix the cavity. And it's the first time your child has to do this. And parents are freaking out, oh my God, how did we get here? And unfortunately, it's completely normal to get cavities. They're inevitable. They are preventable, but it is inevitable that at some point in our lifetime we may have one. And seeing when the parents come in and how tense they are, and seeing how they are, and then as the procedure goes on and they see how calm their child is, and we're able to connect with the child, because that's the most important thing, is being able to connect with our patient, give them the confidence of understanding what is happening. And I think that's where we as pediatric dentists thrive, is we're able to kind of explain things to our patients in a way they can understand, and kind of get them to then relax. And then I start seeing how the parent is able to breathe. And at the end of everything, they're just able to let everything go. And
the parent is probably taking from your explanation too, right? that feels grounding for everybody in the room, probably.
Yeah. So many times, when I'm doing a treatment plan, I have to ask the parent, please, speak very little about what's happening. Just tell them we're going to clean their teeth, we're going to paint them, and let me do all the talking, because many times we don't realize, and as parents, we want to maybe prepare our child, but we may not be doing it in the best way, and we may be using words that we don't necessarily use at the dental trigger.
Yeah, yeah, yeah. On the other end, also, I don't know how you feel about this, but even just doctors in general, I don't really love or recommend when parents kind of do the opposite and they're like, nothing's gonna happen, nothing's gonna hurt, nothing like and they do this a lot even with like a shot. Let's say it's like a vaccine day at
100%.
a doctor and they're like, nothing's and I'm like, you don't really know your child's subjective experience, and that's very invalidating for your child. And then they feel like betrayed. Do you feel like that aligns with
So I always try to prepare my patients for everything before it happens. So that's why I also think
Mhm.
it's so important to have those early dental visits because especially those first visits when they come in for their checkup, what we call, I guess, the preventative, the checkup, the cleaning, the exam, all of that. Those are kind of easy visits where your child can get to know us, can get to know the office, can get to know the tools that we use, can get to know everything's going on so that as they grow, they're coming every 6 months. They are comfortable with everything. And
Yeah,
guess what? Studies show if you come in early on at that first dental visit, which is recommended by the American Academy of Pediatric Dentistry to be age 1, and you follow through every 6 months
I'm a
after,
late.
the reduction rate in caries is huge. Your risk factor becomes so low because that first visit, we're creating a dental home. We're getting to know you, your child, your routines at home.
Yeah.
We're, coming up with a personalized plan for your family. It's not one box fits all for everyone. And so at that visit, we're really getting to know the routine. We're able to catch things early on that like, hey, we're doing this. Maybe if you switch and do this, it's gonna cause, less risk for cavities to form in the future. This is the
Yeah.
best way to do it if you're gonna do A, B, or C. So there's a lot of things that are going into this visit. And so at that visit also, if they are a little bit older and already have cavities, I'm able to prepare the child for what will come next at that
Yeah.
visit. I kind of take them to where it's gonna happen. I kind of show them like if we use the nitrous, which is the laughing gas, what it looks like. I explain it to them in a way they can understand what's gonna happen. And so they're prepared for that next visit.
Yeah, so then it's like in every other realm of parenting, what I suggest, which is really giving them a sense of predictability, which is safety and control, right?
Exactly.
And you're doing that by doing the hands-on experience of what things are gonna look like, but also explaining to them what to expect. Anytime we can mentally prepare our kids, but you're right, sometimes parents don't have the right language, and it can feel
Yeah.
probably too ambiguous or scary or intimidating. So, what is some of for people that are listening to you that don't live in Miami? Because by the way, I didn't even say your practice's name, but it's Glowing Smiles in Hallandale. It is so wonderful. For those that don't live here, are not local, what are some of the like key terms that you'll use for like the drills or like the like what will you say?
Yeah. So, first of all, wherever you live, I highly recommend you seek a pediatric dentist just because we've gone through extra years of schooling where, believe it or not, like, I don't want to see adult teeth. Like, parents ask me all the time, can I come to your office? And I'm like, I'm sorry, no. Like,
No.
I just want kids. There's a way that we're able to connect with children and the terms and the words we're able to say. And the
Yeah.
dentistry is so different on baby teeth than
Mm,
permanent teeth. So, I highly recommend that you do seek a pediatric dentist.
that's good to know.
Those first visits, we show them all of the tools. Depending how old they are, we may start with a simple toothbrush because that's what they know. That's what they're used to. So we'll start with a toothbrush. They have like this whole menu where we make it fun and they can pick their toothpaste flavors. And then we
Mm,
kind of show them what we're gonna do. Then we show them maybe like the vibrating toothbrush that polishes, but we show it to them in a way where they're like, oh, this is fun or this is easy. I know this isn't necessarily your question you asked me, but it kind of leads into
yeah.
everything. Like preparing them, like you can read them books before coming. You can show them little like videos. There's like Daniel the Tiger is a great
Yeah.
one. There's like Melissa and Doug has great
Like the
dental
play sets. Yeah, yeah,
places.
yeah.
You can have them bring their favorite toy, whether it's a doll, a car, whatever it is. We're able to use that and incorporate it into the visit and kind of show them on their
I
whatever
love
they
that.
brought and kind of
Mhm.
ease it into to make it fun.
Yeah,
And then
I love
as
that as a way for parents to advocate for their kids if they are somewhere where maybe they don't do things like that.
yeah.
Sometimes it's the parent that has to be like, "Let's bring your doll, let's try it on your doll first." Sometimes we're not I wish every doctor was like you, but every doctor is not like you.
You know what? Also, like, I think the biggest misconception is like parents are like, I'm just coming in for the first time at 3, 4 years old. Cause I was like, why am I going to bring them in sooner? You're not going to get to look, you're not going to get to do anything. But really, like, we are able to do everything we need to do in an age appropriate manner. Like, yes, the visit's going to look different at 1, 2 years old than it looks at 4, 5, 6 years old. But it's huge how the difference it makes and their comfort level for when they come in at that 1, 1.5 age versus like 4, 5, which unfortunately at 4 or 5, like I'm seeing a whole bunch of cavities many times already that could have been prevented. And so at that
Yeah,
point,
that happened to my oldest.
meeting where we are, which is fine. Many times if they come and they're comfortable, we're able to get the treatment done and have zero issues. My goal is to avoid having to sedate or put them to sleep to do treatment, which unfortunately
Mhm.
does happen a lot. And so coming in early and starting to build that trust really
Good
helps
habits.
all
Yeah.
of that.
I want to take a quick break from this episode to share more about my services offered at Hatch and Bloom. Whether you're seeking personalized one-on-one guidance or insightful group learning, we have the right support for you. Our private sessions provide you with the tools and strategies needed to support your child's growth. So take the next step in nurturing your child's potential and book a session with me today. Please visit hatchandbloom.co. That's .co. Or you can email me at evelyn@hatchandbloom.co. Now back to the episode. Okay, so one. I have to say, I don't really think that pediatricians do a very good job of letting you know that. I don't know if you hear that or not, but I love my pediatrician. I have not heard the word dentist yet, and my daughter is already almost 2.5.
Yeah. So
I don't think
think
people know this.
I think that there are many pediatricians who are amazing, and I have patients find me and come at literally 1 year old, 12 months, and I'm like, amazing. How did you know to find me? Sometimes it's social media, and I'm like, okay, it's working for a positive, everything we're hearing out there. And many
Yeah.
times it's my pediatrician recommended it. And I'm
Mm,
like, amazing. Your pediatrician is up to date with the latest research and the latest, everything. I do go out to meet the doctors in the area. And there are times when I have gone to pediatricians in our area and they're like, oh no, I don't tell them to come until 3. And then I'll
yeah.
explain why it's important to come by 1. And guess what? I started seeing referrals from that same
More.
pediatrician who before was not referring till 3 that are now referring at that age 1 visit. So it's just the things change, the guidelines change, and maybe they're more old school
Yeah.
than what's out there. It's not
Well, I
necessarily.
will be making an appointment right after our podcast because clearly I am a year and a half late.
Listen, but the important thing is that we're on top of it and we get it done, and
Yeah.
we meet you where you're at. So we're all doing the best we can. I have 3 kids of my own, and the first thing I tell parents on that first visit is everything tell you today is a recommendation. You take that and you do the best you can. There's not one box fits all. There's not check we all do this. No, we have different needs as families. Like I would say, brushing morning and night is a recommendation. If you have to pick and choose your battles, make sure the night gets done because we really don't want it to go to sleep with any food
Like the
particles
build up.
because
Yeah.
that's really when cavities start to form. We don't develop saliva. We're not drinking water. I have 3 kids. I'm rushing to get out the door. I'm rushing to get to work. I do my best to brush every morning. Does it happen every morning where I brush perfectly all their teeth? No. But the night they know I brush their
Is
teeth
a
before.
non-negotiable. Okay, I love that. So you have your non-negotiable. So nighttime brushing, non-negotiable. Let's kind of segue a little more into brushing teeth because it seems to be one of the least favorite parts of every parent's day and every child's day. And I want to know if you have any good tips and tricks and what do you
Yes.
kind of do?
So I have a 2.5-year-old that I currently have to literally lay on the floor and put my
Mm.
legs over his shoulders to get his teeth brushed because he wants to do everything on his own. And he cries bloody murder until the 10 seconds till we're done. And once we're done, he sits up and he's smiling and laughing again. And he gets the toothbrush and his brushes on his own.
Okay, so sometimes it's going to look like that.
It looks like that. And it's
Yeah.
not like that every night, but it is some nights. And it is
Yeah.
what it is. When should we start brushing? Ideally, we should start brushing from day 1. So that's going to look different if we have teeth or don't have teeth. When we don't have teeth, we can use a washcloth. We can use a little gauze. They even have these wipes, these oral wipes that are made for it. So ideally after feeding, we would love to wipe the gums and brush any of the milk particles that could be sitting on there. Now, this also starts desensitizing for future for when we are going to start foods, when we're going to start brushing. They're already comfortable with kind of you're in their mouth and you're moving
Yeah.
and you're doing everything. If we're
Because
starting,
it is actually very invasive if we think about
it
it.
is
Yeah.
100%. We're
Yeah.
in their personal space. When I'm like, they're not, so once teeth come in, we want to switch to a soft bristle toothbrush. So once that first tooth comes in, we already want to switch to a toothbrush. And really, these first ones, we don't have a lot of teeth. It's quick, luckily. It's not a 2-minute thing that we need. It's a few seconds. I personally, when they're young, like to brush their teeth on the changing table. So I have the toothbrush and
Mm,
toothpaste in their room. I don't brush in the bathroom. In their changing table, change their diaper, put the PJs on. Okay, put a little smear size of toothpaste or no toothpaste at all if you decide not to use toothpaste yet, and brush their teeth few seconds, put them to sleep, take the toothbrush, and go rinse it off in the bathroom once they're in bed. So changing table is a great one.
That's a good
Uh,
idea.
Another one, sometimes, like I said, you have to throw him on the floor and put my legs over, and it is what it is. My 5 and 6-year-old, there are some nights where I'm like, "Guys, go to bed. I'm gonna bring everything to you. Like, I've had it. We're done for the day." And literally, when they're laying down in their bed, I'm brushing their teeth there. "Good night, love you," and I go rinse
What
the
happens with the water? There's no water?
so the new guidelines actually say spit, don't rinse. So I
Ooh.
rinse my mouth after I brush because I grew up doing it and it grosses me
Yes.
out too. But my kids do not rinse with water.
Really? I didn't know that.
They
That's a
want
really
that
good.
topical effect. So we're using very little. So under 3, we wanna use the size of a grain of a rice, so a little smear.
And then
Over
tell us what toothpaste you like for
Yes,
little toddlers.
that's a huge that could be like a whole podcast in itself, but I'll get into that. And then over 3, a pea-size amount. What toothpaste? I follow the American Academy of Pediatric Dentistry, and I see too much, so I use fluoride from the moment the first tooth erupts. So I personally like Tom's of Maine is what I use with
Mhm.
my it comes with fluoride and without. Why do I like that one? It doesn't have added dyes, it doesn't have SLS, which is a material that causes, like, the foaming on the toothpaste, but that
Mhm.
can cause burning sensation for many children, and so I
Okay,
stay
but
away
you use the one with the fluoride, you're
with the
saying?
fluoride, yes.
Okay.
I have families, which is why these first visits are also very important because, like I said, not one box fits all, that try to see kind of the background and what they would like to use, how they feel about certain things, and some families don't wanna use fluoride, and for that, there's an alternative called nanohydroxyapatite, which is a little bit it does the same thing as fluoride, but it's more natural. And then there
Okay.
are some parents who decide not to use anything, and that's okay too, especially if they're already in my office at such a young age and we're
Yeah.
able to do the risk assessment and kind of move on from there.
Okay, so that's a really good strategy. So sometimes not even bringing them to the bathroom, just not moving them.
Sometimes also, like, in the bathroom, I don't know if this has happened to you, but, like, they move around everywhere, and it's so hard, and you may cause them to gag, and then they're like, "No, I don't wanna do this." Like, "What
Yeah.
is this?"
So my toddler right now, well, luckily she loves brushing teeth, but because it's such a power thing for her. So I have like 4 toothbrushes, I have like 3 toothpaste she gets to choose, right? So it's like I want this one today and then she knows it's one for mommy and one for her. And will do absolutely nothing except for suck on it, right?
Yeah.
And then I do it for like a few seconds and like we've got a system and it works. But she is she is all over. She is not sitting still. That's for sure.
Whatever works, works. I always say, like, I have multiple toothbrushes too, like, "Which one do you wanna use today?
Mhm.
Mechanical, electric?" Great, whichever one you pick. "Which toothpaste you want?" I have, like, 5 different
Mhm.
toothpaste. My daughter likes one, my son likes another, the little one doesn't care. I'm like, "Great, pick whatever you want, we'll use that." "Oh, you wanna sit today? Okay, let's go sit. You wanna sit on the couch?" Sometimes when they're sitting and they have, like, their back against the couch and you come from behind, they're, like, still, so it's easier to brush versus, like,
Right.
moving around everywhere and they're standing up or even laying down, whatever works.
It's true because 'cause they're a little uncomfortable. And then a follow-up question with that, because I know that for adults, I think it's supposed to be like 2 minutes. Like, that's like 100 years in little kid time. So, can you just guide us through what's necessary?
I would say for your youngest, honestly, 10 to 20 seconds is more than enough.
Okay,
You
great.
just wanna make sure that you're lifting that lip and getting, those teeth because the food really gets stuck between the lip and those teeth and getting those molars areas. These front teeth, the baby teeth will fall out around 6, 7, the top 7.
Mhm.
These back molars won't fall out till they're 9, 10,
Forever.
11, sometimes even longer if they're delayed, dentally. Where I start seeing the cavities is in these molars around 6, 7, 8. So I always emphasize, like, trying to brush good there, and not just brushing, but we have to start flossing as soon as the teeth start touching. So that can look different for everyone. It's once the
Yeah.
teeth touching, we wanna start flossing because the chip
Okay.
between the teeth, and that's where I start to see the cavities usually.
Okay, and what do you use for floss for kids? The Picks or, like, the regular.
So I love the string floss, but let's be real, you need a little bit good hand dexterity to, like, be able to floss, especially on your child. So I like the ones with they're like little picks and they have, like, the string, kinda like a Nike sign with,
Yep.
like those are the ones I like, with the handles. I just think it's better. You can give it to your child, they're gonna try to play with it, and that's fine. You can grab their hand and do it with them, or you can go in and do it after. I always say start with the molars, the last 2 teeth on each side, and if they're good and the teeth are touching the front, and then they let you go to the front. But the back is the one I
The
really, really
most important. Yeah, those are the ones that I always have my cavities on, so.
yeah. Same.
Okay, and flossing is for a kid, how much? Like, once a day?
Once a day, I prefer nighttime. Everything nighttime because at
Everything
nighttime we
nighttime.
produce saliva. The pH in our mouth becomes very acidic. You know how you wake up in the morning with a very dry mouth? Like that's
Yeah,
like party in your mouth, cavities forming time. So
okay. That makes sense. Okay, so in terms of time, you're not so strict. It's just like get all the teeth. I know that people say like sing a song or
Yeah, so I
okay.
think that's great because setting the expectations. So if you they kids thrive off of routine. So if they every day or every night you brush, you count either 1 to 10 or you sing their favorite song, and as soon as the song is over, you're done, but you have to be done because they know there's a start and there's a finish. Things will get easier because 'cause they're gonna say, "Okay, I know once this is done, I'm done with this."
Yeah.
So
And
they
maybe
feel
that's part of the choice you can give them, like pick the song that you wanna sing or you want mommy to sing or whatever, instead of just like counting to 10. Like that makes it a little more variable
exactly.
and fun.
And if they
Okay.
have older siblings, making like a toothbrush party or brushing with you, like making it fun, just making it something that, they look forward to. My daughter's to the point I have such different personalities. My son, he's 6 year old. I have to chase him around the house, like, please brush your teeth. You're gonna get cavities. I don't care if I get cavities. I'm like,
Mhm.
great. Wait till you get one and then you'll see. And then the worst part is like they'll probably have a great experience and want to come back. And my daughter's like, here's the floss, mommy. Like one today. I'm like, great.
Yeah, yeah, yeah. I gotta tell you, and then we'll segue into this a little bit because when I used to take my daughter when she was younger to the dentist, she was probably around 5 or so. She has been a thumb sucker forever. She is just turned 10. She sleeps with her thumb in her mouth. Like it's really been so hard, but she also hasn't really cared to get rid of it. And only now, and it wasn't even the dentist. I took her when she was younger and I'd be like kind of like nudging the dentist, like, isn't this gonna like ruin her teeth? And the dentist would check her bite and be like, it's actually not affecting her at all. And I would be like, can you just throw me a bone here? Like, so for years they told her like this really isn't doing anything. And then I took her to the orthodontist who said she's got to stop soon because if not, it really is affecting like now the placement of her teeth and all of that. But I need a lot of help with that.
It's hard. It's hard.
Yeah, it's really different than a pacifier, right? A pacifier you can take away. A thumb you cannot.
It's cut off.
Yeah, and she's the same thing where she doesn't care. Like she knows her dad, my ex-husband, sucked his thumb till he was 11 or 12. Like it's in the family. And she's getting ready to try and stop. Her orthodontist gave us a tip. I don't know if you've heard of this, of like putting a sock
Yeah.
safety pin to her pajama, like a long one so that she can't access. I don't know if you have tips for
Yeah.
I know it's age dependent, but what do
So,
you
like, for your daughter who she's 10 or almost 10, putting the sock, it works, but she can also, if she really wants to, can take it off. So it's kind of just a reminder. So that will only work if they really wanna stop as a reminder. A few things I recommend is one is this nail polish that doesn't taste well called Mavala. I recommend it, but very lightly. I always warn parents, like, this will probably not work. It literally works 1% of the time, but if
Oh,
it worked,
wow.
it was something very easy to do. And so if she wants to stop, that might be a good reminder, like, "Oh, this doesn't taste good. Let me, take it out." So that could work. Another thing is something called a thumb guard or even a finger guard, because sometimes it's girls usually actually suck these 2 and boys usually these. Obviously, it's not always, but that's kind of how it goes. So it's a little guard. It's not very expensive. It's like 40 bucks online. It's a
Yeah,
plastic thing. It doesn't look great, but, like, you could put it on and
I
you
know
wrap
which
it, and
ones.
so it's a good reminder, like, "Okay, you can't suck." Especially if you wanna stop, that will probably help.
Yeah.
And then the next step, when she's this age, it depends if they already need phase 1 orthodontics or not, because usually when they do need that phase 1, which is the expansion, they'll have an appliance in their mouth, and that itself will kind of help them
It's like
stop.
that cage. Yeah, yeah.
Well, the
I
cage
think
is
we're
different
waiting.
because they're
Oh, the
preg
cage is different.
so
Okay.
the expansion, it's if she needs it, it has something in the palate that's
That
gonna
she can't,
expand.
like,
So
put it
so
in.
when you put your finger, you're not getting that soothing,
Mm,
of the thumb being against the palate so that they tend to stop. The next thing, if they don't need ortho, is this cage that you're talking about. Looks like a
yeah.
little cage inside, and actually that works very well for, like, the 9, 10-year-old, age range. I've had many patients that the thumb actually did affect their bite tremendously. They had a huge anterior open bite, so they look kinda like this, and once we stopped, we put that in, less than a month, you could start
That was
seeing
it.
was correcting also.
Mhm. Do you have like, things, like, alternatives? The thing that it's like her soothing, right? So it's really hard for her to know how to soothe. She really only uses it for sleep. What do you suggest? Is it just, like, typical, like, I don't know, "Here's your stuffed animal."
Yeah.
What are
So
you
it's
supposed
hard, like, I've had patients where, like, the parents are like, they have their little lovey, and they only do it when
That
they have
she
a
has her lovey.
and, like, guess what? One day they lost the lovey, and they didn't suck their thumb, so I just kept it lost, the
Yeah.
lovey, and, like,
Yeah.
it's the solution solved. I was like, "Wow, that's great." I have parents that are like, "Oh, one day she just decided to stop and she stopped at 3." I'm like, "Well, that's amazing. This is not the norm. The norm is kind
Yeah.
of what is happening with your daughter." And so, like, when they're younger and they're showing signs of wanting to stop, I positive reinforcement. I'm always like, "Never, you're not a baby." No, it's always
Right.
positive. You can start talking about, like, how we touch everything and there's bacteria everywhere and we're putting that in our mouth and we don't wanna get sick. You can do a calendar, put it on the fridge, so every day they don't suck their thumb, you put a star. At the end of the week, you take them out to ice cream. At
Yeah.
the end of
Like
the month,
incentives.
fries.
Mhm.
If you can stop the habit for 21 days, you've broken the habit.
Yeah.
It
Yeah.
just gets a little bit harder when they're a
When
little
they're older, right, because they know, and yeah, I think it's at this point, it's gotta also be her will because she is older, and I think she's getting there, so the youngest one, I, like, made sure she took the
yeah.
pacifier
That's the
because I
biggest
was
recommendation. I'm like, "Listen, put that pacifier in. They may not want it at first, but
I
if you see the thumbs going in, put the pacifier in."
I was like, "You are gonna learn the pacifier. We're not doing this again."
Yeah.
And she does. So here's my next question about pacifiers. Okay, so what is the recommended age to stop? She only uses it for sleep and in the car. That's it.
So this is like this whole new I don't know how familiar you are with like myofunctional therapy and like airway dentistry and all of this, which it's
No.
amazing. Like once you see it, you can't unsee it. But the guidelines for this have been changing drastically over the last few years. Like when my son is 6, and when he was younger, the guidelines was like try to stop by 3, hard stop 4. Then my daughter, it's like try to stop by like 2, hard stop 3. So right now we're at like ideally we want to stop by 2, and I always tell my patients hard stop 3. So at 2, try to minimize it, try to use it only to sleep. Like I try to tell them like they're very smart. Talk to them, like tell them like this is only to sleep. Like, oh, you want your pacifier? Are you ready to go to sleep? Or like when you wake up and you want to
Right.
get out of bed, are you ready to get out? We have to leave our pacifier there and like come out. So we start minimizing the use. I
Yeah.
also recommend like if they go to school full day, they copy their friends. So like don't send the pacifier to school.
Yeah.
They will start napping without the pacifier and have 0 issues. So like you're slowly
Mm.
the
Yeah.
time using the pacifier.
Okay.
Really 2,
So
hard
by 3. Okay, I'm gonna use the 3 hard stop because I'm not ready to deal with it.
and usually it's us not ready, like, me too, I
I'm just
remember
not ready to deal with it. That's
I
what it
was
is.
like, "Oh my god, how am I gonna do this? My kids are so attached to this," and guess what? It was so easy. My oldest, like, literally, I told him, "When you turn 3, like, that's it, you're a big boy." He turned 3, he had the pacifier in, and I'm like, "Ethan, what are you doing with that?" He's like, "I'm sorry, I didn't realize," and gave it to him, and gave it
Wow.
nap
What
time,
what did you use in terms of, like, stopping, like, any of these little I know
right?
there's people that are like, "We're saying bye, we're doing a whole party, we're giving it to a baby." Like, there's, like, a million things. Do
I
you
honestly didn't do anything, but I
nothing?
do recommend all those. You can plant it, and then you have a lollipop tree.
Oh,
You can
that's cute.
go to Disney, and you literally pack them and you give them to Minnie, like, they'll
I
take
heard
them.
that they take them, the characters, right?
Yeah, so you can
Mhm.
do that. You can say, like, "Oh, you're a big boy," and take them to Target and buy something,
Yeah.
and this is for so and so's baby, like, whatever, or
Yeah.
bring them to the dentist, and I give them a prize instead.
Yeah.
There's a whole bunch of, like, fun things you can do, but they honestly adapt so much quicker than we think. Like, it's
Yeah.
always, like and for everything, not just the pacifier, like, I drive myself crazy for so many things, and then they end up being fine.
Being more okay than
Yeah,
we're, like, making it's so
yeah.
giant in our heads. I know. I'm gonna get there soon. I also feel like I have to tackle potty training, I have to tackle this. It's like all the things that I
100%, you don't wanna do it whenever there's,
at the
like, a
same
change.
time, right.
Oh, for sure, like, I always say, "Do one and then the other." Like, listen,
Mhm.
we do the
Mhm.
best we can.
Yeah, yeah.
It's okay, you don't know a 40-year-old that sucks their thumb, like, I mean, maybe they do behind closed doors, but I don't
I
really
did
know.
meet somebody who was in her 30s that told me she still sucked her thumb every night, and, she needed everybody to know she didn't care, and I was like,
You know what I
"That's"
mean?
but that's one
Yeah,
person.
one
Okay, and another thing I wanted to target that I know we had written here are can you share with us you know you want to talk about eating habits, things we can do to decrease cavities risk.
yes. So to me, this is, like, the most important thing. So when
Okay,
you come
let's
to my
hear.
office, you are not just getting, the cleaning, the exams, the blah, 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 you're getting my whole spiel of the diet, and I actually send you home with, like, a little paper that has a list of things that don't cause cavities, might cause cavities, and easily cause cavities. Because a lot of times we think it's the sugar that causes cavities, but we're really not eating
Wait,
candy all
I heard it's like the goldfish type stuff. Is that
it's the
true?
gold it's carbs. It's the chips,
Carbs. It's not the
any carbs. Chips, cookies, crackers, pretzels, goldfish, bread, pasta, challah,
Mm,
all the good stuff that gets stuck between our teeth and the grooves and fissures and causes cavities because that breaks down into acid. So think of it, when it touches our saliva, it becomes sticky. So
mm.
Sticky is icky is what I tell my patients. So, like, the gummies are the absolute worst. Those
Yeah.
multivitamins, we give them in the morning and send them to school, guess what? I start finding cavities in all of the baby molars because we give it in the morning, it sits there all day long, causes
Yeah.
cavities.
Yeah. So if you're gonna give those in the morning, brush your teeth after.
Brush and floss, yeah,
Well, and
basically, because it
floss.
gets stuck in between, you know?
Yes, yes.
It's so what I recommend usually is I'm not saying don't give any of those things, like, I have 3 kids. My kids, from the moment they get home from school tomorrow, they're so, "Mommy, I'm hungry. Mommy, quiero snack. Mommy," and I'm like, "Guys, we're not gonna eat, play, eat, play." That's the number 1, is we don't wanna graze and snack all day. It's sit, eat. You're done eating, kitchen's closed, so I say it's over again.
Mhm.
Why do I do this? Every time we eat, the pH in our mouth becomes acidic. It takes 2 hours from the pH to become from acid to neutral, where cavities won't form. So if we're constantly at this acidic environment, we're going to get
My
cavities.
god, this is, like, for me because 'cause I'm snacking
100% for me
all
too.
day.
Like,
Oh
listen,
my god, this is such important information for
do as
me.
I say, not as I do. Like, it could
Oh
be
my
anything. It
god.
doesn't
But
like
I didn't
literally,
know that.
yeah.
So that's what it is for us too. So, like, if we're eating all day, we're acidic all day?
Yep. Yeah, so we're not sick. So,
Interesting.
like, it could be even,
So
like,
it's better to
drinking
have
black
just contained
coffee. So, like,
times.
you can drink your black coffee with no milk, no sugar. You're like, "This is fine." I love to do that and go and sip between patients, but that's, like, the worst thing I can do because it's acid. So I'm constantly in a sweet environment. Even water with gas, like my LaCroix, not sipping on that throughout the day. It's like with a meal is best. Like,
Okay, this
drinking
is really,
normal,
really just huge for me.
this is so we can brush and floss all we want, but if our diet is not there, we're gonna get cavities.
Okay, so the first tip is contain your times. So you
Yes.
said around, like, at least 2 hours in between. Like, you have a snack time, you have a
Exactly, stick to snack,
Yep.
lunch, snack, dinner, like, stick to that and we'll be golden, kind of.
Mhm.
Also, it's, like, really the carbs, so if we're gonna open a bag of chips or goldfish or whatever, I'd rather you eat it all at once and have some now, have some later, have some later. Because again, it's the
Mm.
exposure. When we eat, that gets stuck there. So, for me, my kids come home, they know the pantry's off limits. They know they have to ask me for the pantry because anything in there is
How
processed.
old are your kids? Just curious.
6, 6, 5, and 2.5.
Okay, so even the 6-year-olds and the even okay,
Tho
awesome.
those the like, the one that pays the most attention to me in that sense. The 5-year-old will, like, hide, you know, like, she gets candy or whatever from school and she'll hide and eat it. The 6-year-old will not, for some reason, like, lie to me and, like, will tell me, like, "I did this. Am I gonna get cavities?" But personalities, you know? So what I always tell parents is, like, "I'd rather you give the carbs first, so the crackers, whatever first, and then we can do some slices of apple that's crunchy, or celery, or pears, or carrots and hummus, or cucumbers, like, cut them up because all of that is crunchy, it acts like a natural toothbrush. So
Oh, how
I know this sounds
interesting.
counterintuitive, but do the carbs first and then do that. It's not the whole
Oh.
apple, like, I cut the apple and divide it into 3 with my kids, and I feel like also when I cut the fruit, they tend to eat it more, like, than just giving them the whole apple.
Okay, so the ones that act as natural toothbrushes are you said apple, celery, what else did you say?
Cucumbers, carrots.
Cucumbers. So, like, fruits and veggies that are
100%
hard.
crunchy, yeah. So, great things for snacking are fruits and veggies, are yogurt. Cheese is really good to neutralize the pH in the mouth. So, like, in my
Mm,
office, I have, like, a little fridge in the waiting area with waters and cheese sticks because kids come home, like, to the office from school,
ravenous.
and, like,
Yeah.
cheese is great, it helps neutralize the pH in the mouth, so having that. If they're not allergic, any kinds of nuts. I hate nuts, my kids love nuts, which is great, so, like, they'll eat a whole bag of pistachios and, like, great, that's I'd rather that be stuck in between their teeth because it's protein than, like, the carbs that causes
Yeah.
cavities.
Yeah. Oh, wow, this is so informative.
So those
Yeah.
are, like, little things we can do, and then, like, for sweets, again, sticky is the worst, so gummies are the absolute worst. My kids, like, go crazy with ice cream and popsicles, like, you know, that's, like, the biggest treat for them because 'cause I'd rather give them popsicles or ice cream, it's gonna melt away. The next best thing is chocolate, obviously dark chocolate,
But
but
I
any
heard that, like, chocolate is bad because of the
because
candy.
of the coating.
Yeah, yeah. Okay.
I mean, you know what? You can't go like, again, you do what
I mean,
works,
my
like,
daughter
yes,
has M&Ms all the
best,
time, so
but
I'm not saying that.
exactly, like, that's how I probably
I'm
train my
just
kids.
blurting out something I heard.
Go to the bathroom and, like, their when they're learning to potty train, like, their treat is, like, those mini M&Ms.
Yeah, 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 yeah.
You know what I mean?
I'm
Everything
not
in
coming from a
moderation.
place of I don't give my child this, I promise. It
Yeah,
was
no,
just
but I'm saying,
it's
like, we do
simply
the
I
best we
heard
can.
this.
There's obviously, like, I'd rather give them that than the gummies. Gummies are 10,000 times worse. Like, another thing when they're older, so, like, your 10-year-old, if you let her, chewing sugar-free gum, and even this for us, I'm all for it. Sugar-free gums, like, xylitol is fine, the ones that have xylitol, because that one helps stimulate saliva. The saliva helps neutralize the
Oh,
pH in our mouth, so it helps prevent cavities, and also it removes anything that's sticking on our teeth.
okay.
So, my
Okay.
kids also think that's, like, a huge treat. They're like, "Mommy, can I have a chicle?" And I'm like, we'll see how you behave in a little bit, and we'll see if you
Yeah.
win." whatever, as long as they
Yeah.
don't swallow it, you know? So those
Yeah.
are, like,
That's
things
so
I can
helpful.
do to minimize the risk, and drinking a lot of water. Water, 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 plain water.
This is so helpful and so informative. There are
Yeah.
so many things I didn't know here that I will definitely be taking home today. I just hope I think this was really beneficial for parents with kids all ages. So thank you so much for being here today. Do you want
Thank
to
you
just
for
share
having me.
where you're located for the ones that are local so they can come find you because you're the best?
Yes, yes. So my office is called Glowing Smiles Pediatric Dentistry. It's in Hollandale. And we've been open for about a year and a half. And I'm just so proud of what we have created. And I'm so thankful to be in such an awesome community that has been so welcoming to me. And it's been awesome to just like grow and bloom with your kids and see them, from infants to toddlers to teens up until they go to college and yeah,
You
focus
see
on.
them until what age? What is pediatric dentistry
You
till?
know, if it's a child that has special needs, I don't care the age, I'll see them just because general dentists may not be as comfortable.
Yeah.
Ideally, once they're in college, if they're ready to go, I'm like, time to find an adult dentist and I
Yeah.
help them. Many times they're not ready to leave yet. It's really when they're ready, unless they have needs that at this point an adult dentist should be treating them, then
Yeah,
I'll
because it feels really nice when you build a relationship with
yeah.
somebody, that's very secure feeling and comfort. And then you're also on social media. So you wanna just throw it out there?
Yes. So our Instagram handle is glowing smiles underscore Hollandale. And Facebook, I guess Glowing Smiles Pediatric Dentistry, I'm
I
not
haven't
really
been on
sure.
Facebook in like 100 years. Yeah.
You can Google us and you'll find us. I think our website is glowingsmiles-pd.com. And then if you ever have any
Awesome.
questions, reach out, call the office. It's very easy to get a hold of me. So yeah,
Shami, thank you so much for being here. This was awesome.
thank you for having me.
Hey everyone, it's Evelyn. Thank you so much for tuning in. Your support truly means the world to me. If you're interested in hosting a parenting workshop, I'd love to connect. Whether it's a private session for parents, a school event, or a corporate workshop, I'm here to help bring valuable insights and strategies to your community. Let's chat and make it happen. Please visit hatchandbloom.co. That's .co. Or you can email me at evelyn@hatchandbloom.co.